What's up, you Asia bees? Welcome back to another episode of 3 PTs in a Pod. This episode we talk about physical therapy pet peeves of ours, what keeps us motivated within the profession of physical therapy, and finally plans for improvement over the summer. All right, guys, welcome back. The boys are back. Episode 6 underway. So we are rested, relaxed, just getting off finals. We had a nice little week in between. Just started our summer semester. As you can see from my beautiful natural tan, had some time to get on the beach.
Transitioning to a different race.
We had class outside yesterday.
This is all it takes.
I was blinded by the light.
This is my orange skin from just competing in a little bodybuilding show, so don't mind my orangeness. But anyway.
It doesn't look that bad on the...
No, you're getting washed out by the light.
Yeah, I probably can't tell.
Show them the legs.
Oh, there we go, boy.
Golden.
All right.
Golden pony.
So, yeah, de-stressed. Orange juice, that's my nickname now, until the tan wears off. So when I do have the orange skin, we'll go with OJ. Yeah, so finals are over, thank God. So we're going to use the beginning of this episode to vent a little bit, get some frustration out. We just got through finals. Even though we've had a week in between, we still need that stress relief, I think. So we're just going to go all in on some pet peeves of ours within physical therapy, whether it's PT school, physical therapy in general. Just get some things out. Let it out a little bit. So anything you guys want to start with?
I know you had a good
I think you should.
Okay,
Yeah.
so one of mine, all right, is...
You know it's bad when his voice gets like
Yeah. You know.
clasping his hands
Just
again.
get
Start standing up.
Birdman, little Birdman action there. So, guest presentators, guest presenters, all right. When they come in, now most of them are great, but some you get, and it's like they need to like show their superiority over us.
Yeah.
Like, I don't know if you guys have picked up on it, and I'm not going to, like, say any in particular, but there was one in particular this past semester.
We
that
know who you're talking about.
It's
I
like,
know.
the guy just, like,
Guy.
you know, well, I do, like, you guys will do this, but I do this.
Yeah.
Like, I have this specialty thing, and I do this, like, nonstop all the time. Like, all right, dude, like, go fuck off. Like, you're not any better than us. Like, just because you do, I don't know. It just bothered me. It was
I know
like
exactly what you're talking
always
about.
framed in like, well, I'm like, I do this and you're just students. So like, you know, fall in
Yeah.
line and like look up to me because I'm so cool and do
Right,
this like
right.
specialty thing. Like, all right, dude.
Making himself out to be like so valuable
Yeah, and
to
important.
us.
Like, all right, man.
Which, I
like,
mean, you
I
know,
respect people coming in and sharing like their expertise with us and, you know, what they've been working on, and especially when it's like specialty things, because, you know, they obviously are the ones with the most experience, but, you know, don't act like you're some god within physical therapy.
And then don't also, on that front of guest presenters, don't make your presentation boring as fuck.
Yeah.
Yeah.
Like,
Yeah.
nothing worse than a guest presenter and then, like, they don't give you any breaks.
Yeah.
They're dry as shit, reading off the slides.
Yeah.
Nothing worse than that. At least
Yeah.
make it interesting so we're actually interested in what you do.
Yeah. Yeah, and it was like they'll ask questions almost in a way of like knowing that no one knows what the
Yeah.
fuck they're asking or like what the answer is. And because it's like, again, a specialty, like, sorry that we sit through 8 hours of class every day amongst like 4 different topics. Sorry we're not like spending 5 hours a day on the topic you're here to talk about, and we
Yeah.
don't know like the answers to your questions that you probably didn't even know until, you know, you were doing it for a
Yesterday.
few years. Yeah. So
Until you looked it up the day before.
looked up like 10 different things right before just to like ask
What
questions
did this
that we wouldn't
research
know.
study say in 2004? What, you don't know that?
You guys haven't heard that research article? Like, come on. So anyway, that was one of mine that I had thought about.
That's a pet peeve of mine in general, is the not making the lecture interesting. That's
Yeah.
like, especially when we present to each other, it's like, come on, don't be reading
That's fucking
off the
brutal.
slide from
Yeah.
a research article. Just like do something to make it interesting.
Yeah.
If I have to learn from you, like, you gotta give me something.
Like even if it's silly, like
Yeah.
throwing memes in
Yes.
your fucking
Yeah.
slideshow, like make
Yeah.
it funny,
Make
something.
a fucking meme.
Yeah, make a fucking meme for one.
Yeah, make a meme.
Give me one
Give me
meme.
One fucking time, just give me a meme.
It's easy
That's
for
a
you to
good
say,
point,
dude.
too, though.
Meme king.
Yeah, the meme king. Yeah, that's right. Yeah, no, I agree. Definitely. Presenting is a not an art form, but it's like
No, it
it's
is.
a skill.
No, when
It
you
is.
see like a good presenter, you're like, holy shit, like I
Yeah.
want to do that.
Yeah.
Because how interested you are and like how engaged you are, you're like, I want to get people engaged like that.
Yeah.
Yep.
But it definitely takes practice, and you could tell like literally practice beforehand
Yeah,
and like making sure you're prepared.
that's a big part too. Yeah.
And like you could always tell when somebody just doesn't know what the fuck they're actually talking about.
Yeah, and it's almost hilarious when a slide pops up. It's like, oh, I didn't know that was there. Like you
Classic.
didn't make the fucking PowerPoint
Yeah.
or
Classic.
credit.
Yeah.
Credit to
So
this other teacher.
guest speakers, please don't
Yeah,
don't be
lecture
like
in
that.
general.
Yeah.
What else? You got one?
Yeah, I have a pet peeve, not necessarily PT school, but just PT in general. Like our obsession with like rest, like telling patients like they need a rest, and like they can't do, like they say they got hurt doing something, like a PT telling that patient, hey, like you should stop doing that. Like even if it's something they love, like a sport or whatever, hey, you should stop doing that. Like
Yeah.
in my opinion, rest is rarely the solution. You know, you could always be doing something, even if it's just like doing whatever you're doing lightly, as to like you're not like messing up whatever you messed up more. But you know, just telling a patient, hey, like just don't do that anymore.
Yeah,
It's
that's
just
like
so
the
shitty.
classic. Like that's what your neighbor tells you.
Yeah.
That's like, hey Bob, I hurt my shoulder like picking up groceries, and he's like, well maybe don't pick up groceries, huh?
It's
Huh?
just such a shitty
like-
Ultimate dad
word of
joke.
advice.
Yeah.
And that just pisses me off because you could, there's better ways, you know.
Right.
Rest is rarely the solution to whatever problem.
Yeah, I agree. That's what they're there to like find a solution.
Mhm.
Like maybe try one
yeah,
time to
actually
figure
try.
out something
yeah, actually
like.
try to
to
help
do.
these people to get them back to doing what they want to do.
Yeah.
Are
Yeah,
you
that's
talking
true.
about rest in between like sets though too?
No. What are you talking about?
Well, like if you do like 10 reps and you're like, okay, now rest for a little. Are you talking about that?
No, I'm
too?
talking about like telling patients like,
Nah.
say I got hurt fucking bench pressing, and I go to PT,
Oh, okay.
and he says, hey, you shouldn't bench press anymore.
Yeah.
Not like trying to
You
get
find a
down to the
different
bottom
PT,
of like
'cause
why I got
Bench
hurt.
is life.
You know, it could have been like my technique was wrong or something.
Right,
like
right,
that's
yeah.
why I got hurt.
Yeah.
But just telling me not to do it is just like the easy way out, and it's not actually getting to the bottom of like what
Yeah, that
actually
is
caused the problem.
I was gonna say the rest in between sets is my favorite.
Mm.
It's my favorite thing. Just like, oh, I've rested a little, and then I'm like, all right, fuck, what am I gonna do next with this patient? Like the next exercise. That's why I use my rest.
Hey, can I
breaks.
go again? No, keep resting. Keep resting.
Shut up! I'm trying to think.
How about 3 sets of 10?
Oh.
Does that make anyone's
that
skin crawl?
tickles my.
Classic.
I don't even know the phrase. Tickles my.
Classic zero, like critical thinking zero, clinical decision making. You don't actually fucking know like parameters of exercise, everything. You know, you
Yeah.
don't know
Every exercise is
periodization.
3
You
sets
don't,
of
yeah,
10.
you don't know like how to manipulate physiology, how to manipulate the central nervous system to gain strength, hypertrophy, endurance. Like you just don't know, so you just
3 sets of 10.
That's your solution.
Sprinkle that on top of everything.
Yeah.
Yeah.
Going off that, I think just leaving patients to let them do what they do, like especially as we do our clinicals, I think we notice it even more. Like we're watching the patient do an exercise that our CI told them to do, and like something's off a little bit, and like yeah, you could like go in and correct them, but I want like the PT to be able to notice that and like, yeah, I know they're documenting at the same time, but it bothers me when PTs are like, all right, go ahead and do 3 sets of 10
Yeah.
of bridges, and they're like,
that they've been
and
doing.
they're like
Yeah.
doing this on one leg, and if they're
Not-
barely lifting up or something
Yeah.
stupid like that.
Not only that, but like they've been doing that same fucking exercise for
Yeah.
the same amount of sets with the
Repeatability,
same
yeah.
amount of weight for 4 weeks
Yeah.
with zero progress, no
That's
progression
annoying.
to that movement. That's fucking annoying. But to that, like, maybe they're not paying attention because they're seeing 4 other patients at the same time,
That's true.
and they can't actually. You're not actually treating a patient. You're just fucking sending them off to do whatever.
That's annoying too.
So that's like
Just
just
as
shitty
bad,
care.
Yeah.
30 minutes is like way too little, I think, for
Mhm.
for a patient. If you want like one-on-one time,
Yeah,
I
for
think
sure.
45 minutes is a minimum, and then an hour for evals.
45 minutes to an hour per patient one-on-one is like ideal.
Yeah, but I mean, then productivity goes down. But whatever.
Yeah.
Like,
But then that's the thing is
But
like
visits also go
productivity
down.
goes down, but you could also like if say like you're private and like maybe you're cash based or something, you could charge more because you are spending more
Right.
time with the patient. So
Yeah.
like, you'd actually make like you're seeing less patients but charging more, so you'd make up the difference.
mhm.
And I feel like you're providing better care that way.
Yeah. That's another one. I mean, these big like hospital networks and the whole like
Just trying to churn
volume
out. Yeah.
factory. It's like,
Cookie cutter.
yeah. Once
Oh, you
again,
have
going
back pain. Here's your back pain list. Go on table 7.
Yeah.
right,
Do your bridges.
right.
3 sets of 10. Come
Three
on.
sets of
TA
10.
drawings.
Come on, you've been here for 6 weeks. You know this shit.
And that's the thing, like, once again, it's going against our greatest strength as PTs, which is having more time with patients versus
Super
like
annoying.
other medical professionals, and it's just so ass backwards that you take away our biggest strength, and then you wonder why people don't fucking respect physical therapy
Yeah.
as a profession and as a
For
means of like healthcare, you know? And then people want to sit on fucking Facebook and bitch about it. Like, that's another pet peeve of mine. Let's fucking sit on Facebook and bitch about how physical therapy gets no respect. Like, go out and do something one time. How about that?
One time.
Like, maybe go volunteer around the community, like, show people.
Yeah, provide education, set up
Yeah.
a table somewhere at a fucking marathon and
Right.
talk to people.
I mean, maybe work at a pro bono clic, you know?
I don't know,
Who knows?
just throwing it
Yeah,
out
just
Hands
it's
of
an
hope.
idea.
Feet of hope, bro. You choose. Maybe we should set up a table outside and just educate everyone.
Yeah,
Just sit outside Lancaster Avenue, wait for everyone to drive
With a
by.
megaphone.
yeah,
Yeah.
maybe we should.
Slow down. Back straight.
Educate the masses, like those people up in New York City, like
Yeah.
talking about Jesus.
Oh, dude, we had
Protest.
those. We had that at my
Picket
undergrad.
fence.
Yeah.
We just do that on Alvernia's campus, but it's about physical therapy.
Get PT first.
Choose PT. Fuck your opioids.
Yeah,
Bitch.
Oh, you don't want to hear about PT? Oh, so you like opioids, huh?
You fucking
So you-
drug addict. Way to ruin America, drug addict.
Oh,
You're the reason.
You're a fucking drug.
Because you didn't choose PT, now we're at war.
Yep.
That's what happens.
All right, I see how it is.
So, you love war so much. You love to see people die. I get it. Maybe next time choose PT, asshole.
Oh man.
Anyway, that's what I don't like about this. War.
Yeah, war. I mean, it all
War and
it all
fucking
ties
opioids.
together. Yeah. I mean, honestly, dude.
I thought I would have more about PT school. We just like shit on PT in general, not PT school.
Hey, dude. Finals.
PT
just
school is
had
just-
it built
The
up.
profession of PT is a reflection of PT schools.
True.
That's true. Yeah, that's true. Well, yeah, PT school. Let's talk about like.
Oh, these bullshit like extra courses that I like ethics. That's
Yeah.
I fucking hate that
Yeah.
shit. For one question on the boards about it.
Right. So once again, the whole like curriculum of PT school is basically just to cater to the boards.
Yeah.
Which, I mean, is what it is. But
Yeah.
like,
But that's insane to me. In a occupation where you're hands on,
yep.
99% of the time, that's what you're doing. The only thing that's separating you from practicing is a 200 question test,
Yeah.
not like any hand. I don't know how you would
Yeah.
like make that.
Well, you could have like a practical. You could totally have a
Practical
practical
exam.
Yeah.
You're
Yeah.
sitting out there with your case. Fuck, dude. What?
For
How the hell do you do Goni?
You got a really shitty tester.
Yeah, an asshole proctor.
Oh,
But I mean,
man.
honestly, like you have a 200 question exam that's allowing you to practice.
Right.
So you could be shit at palpation and talking to patients and be a PT.
Yeah.
That's annoying to me.
Yeah. and how, I mean, it's how much or how far behind it is in terms of like
Yeah.
what it
Sure.
actually means to be a good physical therapist.
Yeah.
Like, what you're learning in school is not going to have you ready to go into your job day one. So is it really like, are you really learning the best stuff during
Yeah.
school?
I think the case is, I think they're just trying to make it so you're not dangerous enough to kill anybody.
Yeah.
That's
what it
true.
is.
Besides
I mean,
that, it's like you're
yeah.
on your own. You
That's
figure it
true.
out.
You'll learn.
Yeah.
Yeah. I mean, you learn the most on the job. So.
That's true. And hopefully you have people around you who are good at what they
Yeah.
do and a mentor and things like that.
And if you don't, that's on you to seek it out.
Yeah.
Right.
Find
But-
that mentorship.
That's another annoying thing is you'll never be as good as you want to be, probably. Like
That's a good
especially,
thing.
yeah, but it's annoying too for me.
But that's what drives you to get better.
Yeah,
But
but I
it
want
can
to.
still
I
be
want to be.
annoying in the
I want to
process.
be
You wanna be
good
the
now.
best.
I want to
Yeah.
be the best of all time.
The boat. Boats and hose.
I'm on a boat.
So yeah, we basically just shit on PT school and
Tell me.
physical therapy for
16.
these first 16 minutes. So now, in the interest of not being a completely negative Nancy
Nah.
podcast,
Skip it.
Fuck PT.
let's do a little bit of what gives us hope about physical therapy. What drives us? What's happened to us? Different patient interactions that has motivated us that physical therapy is the right thing, that we're a part of the right profession, why we do want to be a part of this whole thing, and why we enjoy helping people out, specifically with physical therapy.
Yeah, I have I was just observing my buddy at his clinic last week over our week off, and there was a woman that I saw, one of their patients that I saw in the wintertime, and she had a shoulder issue, I don't remember, but she couldn't do anything. She was like really frustrated because her shoulder hurt. She couldn't like reach overhead and do all the stuff that she wanted to. And I just saw her this past week, and she was basically like about to get discharged. She's fucking lifting weights. She's
Wow.
doing like push-ups, all this crazy stuff, like no pain at all. And they're like transitioning her out so she could finally like start going to the gym, doing all this stuff. And she's looking at me and telling me about the PT experience, and she goes, "This man's like a miracle man. Like he really like changed my life. I wasn't able to do anything forever until I started coming here." And I thought that was like really fucking awesome. Just
Yeah,
to hear those words and like hear the impact that a PT can make on someone's life.
Mm-hmm.
I thought that was like really inspirational to me, like to have the opportunity to make that change for people. So I thought that was
Yeah.
pretty cool.
It's awesome.
I think I've said this before on here, but like when you're so frustrated with a patient and then you finally do something that works with them, and that's like the best feeling ever. Or like you do a special test that you think is going to be positive and it is, and like your judgment was right. That's like the best feeling ever in my opinion. And then you're like, wow, I can really help this patient.
Yeah.
Not to give a shout out, but it's like duck hunting, if you ever heard of that. You see a duck that you've seen before and you're like, that's a duck, and then you know how to treat the duck.
Yeah.
But yeah, seeing the difference from day one into discharge is probably the coolest part. Also, like telling people that you're in school for PT and they have like a personal, it's sort of like what you said, but they have like a personal experience from PT, and it's like, wow, PT is like the future. Like I loved going to PT. It helped me so much. I didn't want to like turn to opioids or war.
Yeah.
So I turned to PT. I chose PT instead, and I saved a bunch of lives.
Single-handedly stopped the war.
Yeah.
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 It's really
Yeah.
cool.
No, yeah, I think those are both great points. I think just
Saving war.
Yeah, saving war, saving people from the opioid epidemic. But honestly, though, just like you guys said, having the opportunity to truly like impact someone's day-to-day life, and like literally, some of these injuries that people come in with are part of their day every single day.
Yeah.
And
Yeah.
if you can, and that's with us like really focusing on, specifically the impairments someone's coming in with that do impact all their actions basically, or potentially throughout the day, and being able to have an effect on that and possibly eliminate that altogether to make them function without that pain. I think is awesome. And then I think also in like neurological settings, I mean, you know, the physical therapists at times with certain like spinal cord injuries and traumatic brain injuries, I mean, you're dealing with pretty heavy stuff that you're able to have an effect on and be part of the team that gets those people back to functioning, whether, I mean, not to bring war back into the picture, but I mean, let's say someone comes back from, you know, getting a fucking leg blown off. I mean, that's huge, like, that's heavy shit. And if you can be a part of that team, if they're getting like a prosthetic or something and you're helping them get back to, you know, from being in a hospital bed and being, you know, limited to just, you know, a wheelchair or something, and now all of a sudden they're walking or back to playing a sport or something that they had played before. I mean, that's like life-changing stuff that you're not getting as, you know, whatever other job you want to call it. You know.
Well, it's like Ryan Shazier, the Pittsburgh Steelers linebacker, football. The one with like
you kick
the
it?
brown ball.
You kick it?
Yeah, well, you kick it sometimes and then you throw it other times.
Wait, what?
He had a really bad spinal cord injury, and he's been working with PTs for like months now. I think it happened back in like December or November, and he's been working with PTs, and now he's like officially walking. Again for like the first time, and he walked during the draft to like present the Steelers pick, and you could just tell that meant so. This guy was like an all-out athlete, and now he couldn't walk. He probably was bedbound for a while, needed help with everything, and now he's back to walking. And like something so little in the grand scheme of things was so big for him. So and that's from PT. So
and I mean, like all of these stories or points go towards the idea that like you can have an effect in so many different like groups of people's lives, like from adolescents to even like pediatric populations, to maybe allowing them to have a life that they wouldn't have otherwise had, like from an injury, you know, right away after they're born, to geriatrics, to spinal cord injury, to high level athletes.
Jerry's and Peeves.
It's a restaurant. It's a Sunday brunch restaurant, Jerry's and Petey's. But yeah, no, it's just awesome to be able to have that potential across the board to really work with any patient population and to play such a, you know, important role, again, because of that time we have with them. We get to know these people and really what they're all about, their story, why they want to be there, what they want to get back to, and have a role in that. And I again, not for a little self-promotion plug, but pro bono clinic, I think we saw a lot of cool things there. I am the clinic coordinator of our pro bono clinic here at the school, so I have the clock award to prove it.
Clock award.
Large clock.
But even in that situation, you know, being able to help people that might not even have the ability to see a physical therapist, like through insurance or, you know, underserved populations in the community, and helping, you know, those people as well, and some of the, you know, the role we were able to have in some of those people's lives, and seeing some of those people discharged and back to, you know, functioning and being happy, even if there was like a big communication issue.
Sorry, I'm totally listening.
No, I was probably just rambling too, but anyway, that was a cool thing, and another area of PT that's out there to, you know, volunteer your time and be a part of. So
overall, PT, you know, you can make a really big impact on people. Just don't be shitty.
And
don't be shitty.
Even if there are times you want to vent and shit on, be upset with the profession, at the end of the day,
there's always an upside.
Nothing I'd want to be rather doing more. So let's fucking go, boys.
All right, 5.5
so
minutes. Let's do this.
Let's get this next segment on the book. So it is the summer semester now. We're transitioning into the summer semester. We've got about 8 weeks until we start our summer clinical. So we've got basically from middle of May right now until August when the fall semester starts up. What are we doing to get better? What's the plan?
It's a loaded question.
I guess I can start. I think it's always good to get in-person experience.
Mhm.
So anytime you can get like into a clinic and observe, if there's someone that you really like respect and like in the field, getting in the clinic and watching what they're doing and asking them questions and things like that. I'm lucky to have a few friends that have their own clinics, so like I could go and observe. I like doing that, even if it's only once a week for a few hours, and then you just write a bunch of questions for them, and then you're able to ask them every week. That certainly helps a lot. And then reading papers, like KP's favorite thing to do is he just reads entire
You
research
should
journals.
see my study.
Yeah.
I have a
So,
study for research art.
That like trying to keep up, like checking once a month to see like what new research articles are out there, and then reading a few. If you could read one article a week, like that's 52 articles a year. That's a shit ton. That's so like if you could at least do that, that's really good, and keep doing that the entire year, not just the summer.
You should send one out a week.
Um,
You're appointed.
Yeah.
That would
There
actually
you
be a
go.
good idea.
What day?
I don't know. I'll think about it. Sunday morning.
No good for me.
What's a good day for you? We'll
I'll let
play
you
around.
know.
I just got Pat Davidson's Rethinking the Big Patterns course. Me and my buddy got that, so I'm working my way through that. I love all of the shit.
Does he live in Hoboken?
Yeah, I
Mm.
recommend it to everyone.
Good
Maybe we
city.
should go visit him.
We should, dude.
Well,
Hoboken's
did you-
a good time.
Did you see what he posted yesterday? He posted about like the tornado,
Yeah.
like around his
Yeah,
apartment. I
the
guess.
fucking sky was orange
Yeah.
or green.
Oh, like me?
It was just Chris.
Was it my shade of orange? Or,
The juice is loose.
Juice was loose in Hoboken, boy. The juice was loose
Making
in
everybody
Hoboken.
The dark arts.
So yeah, the Pat Davidson course, and I'm reading a book called Human Locomotion by Thomas McCond, I think is how you say it. It's a fucking phenomenal book. I recommend it to everyone. The first chapter, kind of like what you're into, like the whole evolutionary basis of gait. So it goes through like the whole history of from chimps to fucking how we evolved into humans, and the changes that occurred in the gait cycle. It was fucking fascinating. But then it goes through like the kinematics, kinetics, functional anatomy of gait, and it's only like $60 or something. So I highly recommend it to everyone. And it actually goes into the treatment aspect of gait abnormalities. So those three things, kind of reading research, making my way through the Pat Davidson course, and reading this book are kind of my big focuses for the summer.
Before I forget, I have a viewer request.
Oh,
Totally off the books. It was an in-person. I met this gentleman at a bar. We'll say that.
okay.
Nice.
We're not sponsored by them yet, but
No
we're
free
working
advertising.
we're working on Trooper Thorns. But we'll call him Ken
Ken, okay.
Okay.
as his alias, I guess. We should have some sort of link, or I guess in the YouTube description. I don't know if we did do this, but like that book that you're talking about, we'll list that stuff. We'll list like podcast resources, yeah.
Just
Okay.
whatever we talk
Whatever
about.
we
in the
talk
episode.
about, like a
Okay.
link to the articles that we talk
Perfect.
about that we do. So we'll have that. We'll have that this episode.
Ken,
Yeah.
thank
Ken.
you. We
We'll get
appreciate
better
it.
with
Thanks,
that.
Ken.
Yeah.
Yeah, loved what you were just talking about. I think I'm preparing for this next clinical rotation better than I did last year. I didn't really know what to expect last year, and I
Mhm.
know where I'm going this year. Well, I know where I'm going, but I've been there before too, so I kind
Oh,
of know
nice.
what to expect. And the person I'm working with is the only PT in the place, so he sees a lot of evals, which is good and bad. I mean, it's going to take a lot of time, and they're really busy, so it's going to like test me, I guess, which is good. But special tests, I noticed, was something that I kind of needed to work on. Not only like knowing them all for like every joint basically, but like correct procedure. So that's something I want to study. I got an app, awesome app called iOrtho. Has like all the special tests, all the manual techniques for every joint, and videos, research articles for them, sensitivity, specificity, everything. It's awesome.
So, question with that, does it just has all the like special tests and everything, not necessarily just the best ones?
I believe they're in order of like best, and I think there's like a green thumbs up for like the better.
Okay, so
better
that'll.
used
I was gonna
ones.
say like you don't necessarily have to know
Right.
all of them, but you should
Right.
probably know the ones that have
Yeah.
high sensitivity, high specificity.
Yeah. So that's some. I also want to get a treatment table. I don't have one. I know
Good.
you have one.
Yeah.
Really?
$100 $100
yeah.
on Amazon.
Yeah.
Yeah.
It's in my cart.
It's already. Yeah, it's in my cart.
Yeah.
Oh, you said car? Or
Cart.
Oh. Well, it's in my cart. I'm just ready. I'm just waiting to pull the trigger. Maybe this next
Let me know.
this next direct loan.
let me see what
Yeah, there you go.
Yeah, I'll.
Because I love mine.
I have a feeling mine's really short, and I don't want that.
Yeah, let me see it.
Or I just might just build one. You know,
Dude,
just
yeah,
like craft
why
one.
not?
Let's just start selling those bad boys on the side.
Custom PT table.
Yeah, and
Not a
then
bad
just
idea.
like I feel like every one of my friends and family has like a problem, so I'm like, yeah, if I get a treatment table,
Dude,
I'll
I
just
try to
like
get
work
my
on
hand-
practicing my
That's
hands-on
ano-
technique.
That's
for
another
sure.
point. That's a really good point because I try to like in the gym especially. I try to get my hands on as many people.
Oh,
Not to sound
hey,
weird.
hey, whoa,
But
hey,
like if
hey.
they come up
We'll-
to me,
we'll-
and
we'll
they'll be
delete
like,
that.
"Oh, dude, my fucking shoulder hurts or something." I'm like, dude, let me bring in my table. and I'll like check you out. I try to do that to as many people as I can, just because it's a really good
Yeah.
experience.
Yeah.
just practice.
Yeah.
Yeah, absolutely. Yeah, no, mine actually go like right along with yours, KP. I definitely want to do a better job of getting ready for clinical this time around. So going back through, I mean, that eye ortho is a great suggestion. I might hit that up as well, and just back through our notes and looking at MOBs, special tests, just differential diagnosis type stuff, just to be prepared. Because I mean, in the fall, we basically did fall semester was like your extremity joints,
Right.
and then this past
Yeah.
semester was like spine. So
Dude.
some of the extremity stuff is still
Especially lower. We did lower first. You could
Yeah.
ask me any lower extremity special test. I'll be like,
yeah. So just
Valgus, right?
yeah. Refreshing myself on some of that stuff before we get started with clinical in July. I definitely want to also go back through some anatomy stuff as well. I feel like that's still one of my weaker areas. So going back through, what's the anatomy book we have? Not Gray's.
Netter's.
Netter. Yeah, go
Dude,
back
it's
through
on my
Netter.
bed, dude.
Nice. There you go.
Yeah. I think like having that book because it's a good resource because like the images and stuff, but it really is just all pictures.
Yeah.
Like if you have like something like the human locomotion, which has like a whole chapter of joint by joint functional anatomy, and having that anatomy book with you so you could reference it,
Yeah.
or that app that we talked about before that I think it was Complete Anatomy,
Dude,
Mhm.
or Human
I wanna
Anatomy
buy
Atlas.
that. Yeah.
That
is
having
awesome.
that just because like you can look at it in 3D and then you can do like have it do the motions
Yeah.
and see what it does. That'll like
So
definitely
cool.
help you because that really helps me like
Yeah.
when I'm reading and I need to like visualize it.
Yeah, that was my like second point to the anatomy was like not only just like starting with the netter and sort of just the basic like hammer home my memorization, but also the functional anatomy. I definitely need to get on that as well. And then reading as well. I have so the book is called Multidisciplinary Approaches to Breathing Pattern Disorders by Chaital. Yeah.
Leon Chaital.
So I definitely want to get into that. I had started it, but it's a pretty dense read. But after going through the PRI, postural respiration course, not too long ago, want to get back into that and kind of finish that book. So definitely some reading as well. And then just like reading in general, like during this semester, it's so like 100% PT. Like some other books that I've been waiting to get around to, like Jordan Peterson's
Nice.
12 Rules to Life. Want to get into that, and some other like non-PT books on the side just to be kind of overall learning and
My buddy just
digging
met
in some
him.
new stuff. Really?
Yeah, meet
That's
and greet
awesome.
in DC.
That's
He got a
sweet.
picture. He grammed it.
Nice.
Got a lot of likes.
Love that.
He was wearing a 3-piece suit. He looked great.
Oof.
Beard and everything. Slick
Oof,
back hair.
dude.
He's
Yeah.
got it all. Anyway, that's,
Yeah.
that's
Yeah.
just my man crush.
Of the day.
Awesome.
JP.
Sounds good.
So yeah, no, I think that's all we got, right?
Yep.
All right. Thanks for checking out episode 6, guys. Be back next week. See ya.